Thank you.
Muchas gracias. Buenos días y muchas gracias por acompañarnos hoy en esta rueda de prensa. La semana pasada se notificaron más de 490,527 casos de COVID.
A nearly 2.3% decrease as compared to the prior week. A total of 4,797 deaths were also recorded, representing a 15.2% decrease compared with the previous week. In North America, cases increased by 11.2%, and in Canada, hospitalization also rose by more than 20% as the proportion of Omicron BA2 cases grew in the country. As borders have reopened and tourism has ramped up, cases have also surged in some Caribbean countries and territories, with St. Kitts and Nevis, St. Lucia, Barbados, and St. Martin recording the largest relative increases. Nonetheless, on a broad scale, cases and deaths are declining in the Americas. The decoupling of death rates and new infections is proof that vaccines are working well to protect people from hospitalization and death due to COVID-19. Over 2/3 of people in Latin America and the Caribbean received 2 doses, and many countries in our region have some of the highest coverages in the world. With Vaccination Week in the Americas fast approaching, we can take a moment to celebrate this great achievement. Thanks to the tireless commitment of healthcare workers, scientists, policymakers, and citizens across our region, 14 countries have already reached the WHO goal of fully vaccinating 70% of their populations ahead of the June 30th target. And many have made considerable progress since the beginning of the year. There are 8 countries and territories that have already vaccinated more than 60% of their populations. In the first 3 months of 2022 alone, Nicaragua has increased coverage by 18%. Peru and Colombia have both expanded vaccination by 12%. And Bolivia and Venezuela have increased their vaccination coverage by nearly 10%. But in some areas, vaccination has slowed or plateaued. In the Caribbean, fewer than 30% of the population completed their primary series in Haiti, Jamaica, St. Vincent and the Grenadines, and St. Lucia. And across Latin America, Guatemala, Guyana, and Paraguay have yet to reach half of their populations. We now have enough supplies of vaccines to meet demand everywhere in our region. As of this month, PAHO's revolving fund has delivered more than 141 million doses of COVID vaccines in partnership with COVAX and with the support of donors. But we have learned that supply is just the first step. And that's why PAHO is working closely with countries to also provide technical assistance, planning, and communication support to fill the remaining gaps. COVID-19 vaccines work, and they are very safe. They are protecting most people in our region from the worst consequences of COVID-19 infection. We need to extend this benefit to everyone in the Americas. There is no better time to do so than during Vaccination Week from April 23rd to April 30th, when health services across the region will be mobilized to get vaccines out. PAHO's recommendation is that we First, ask caretakers and heads of families to use this moment to get their loved ones vaccinated and to ensure that they are protected against not only COVID-19, but also other diseases. If you or a family member have not been vaccinated against COVID-19, please talk to your healthcare provider about any questions or doubts that you may have. They are here to help you work through your concerns and to show you the importance of getting vaccinated. If you are pregnant, now is the time to get your COVID-19 vaccine alongside your flu shot and tetanus, diphtheria, and pertussis or whooping cough vaccine to protect both you and your child against these life-threatening diseases. Parents should take this moment to get their children caught up on routine vaccines and shield them against diseases like measles, polio, and diphtheria. Vaccination is a family affair, and it is up to all of us to make sure that our loved ones are protected. Second, we encourage countries to integrate their COVID-19 vaccine efforts with their routine immunization systems. When we first rolled out COVID-19 vaccines, countries set up emergency systems to get these life-saving shots into arms as quickly as possible. And now we can leverage this infrastructure and merge it with our routine immunization systems to make it more convenient and accessible for families to catch up on all their shots at once. This month, for example, PAHO's revolving fund has delivered some 15 million doses of influenza vaccine to 9 countries of the region that continue to strengthen their vaccination efforts. Some countries, such as Mexico, Ecuador, and Bolivia, are already working to fully integrate their COVID-19 vaccination with routine immunizations. We are learning valuable lessons from all of these efforts. Countries must invest in increasing health staff so that there are enough qualified people to manage these dual responsibilities. And we can continue engaging new and traditional partners like community groups, religious organizations, universities, and the private sector to listen to the concerns of the communities and to develop effective vaccination strategies together. And lastly, we urge countries to take advantage of the vaccination week in the Americas and intensify their efforts to reach at least 70% of their population with COVID-19 vaccines. Several more countries could reach this target even before June if we increase the momentum. And while we are expanding vaccination, we must make sure to reach the most vulnerable people, as they are the ones that can suffer the worst consequences from COVID-19. Elderly people, those with pre-existing conditions or comorbidities, healthcare workers, and pregnant women remain most at risk of ending up in our hospitals or dying due to COVID. And this is especially true for pregnant mothers. In some countries, COVID has become the #1 cause of maternal deaths. These deaths are avoidable, and the best way to do so is to expand the vaccination coverage for all pregnant women at any stage of their pregnancy. All countries need to focus on reaching these vulnerable populations to ensure that we save more lives and avoid overburdening our health systems with preventable cases. The COVID vaccination effort has been the largest immunization program in history. It has shown us that success is possible when countries and people work together to embrace vaccines. Our region has achieved high coverage and delivered more than 1.77 billion vaccine doses into arms in only 16 months. The upcoming vaccination week in the Americas is an opportunity to celebrate our progress and to use what we've learned to advance coverage and save more lives. And at the same time, we must continue consolidating vaccination coverage to ensure priority populations are fully vaccinated and educated about measures to follow to keep protecting themselves. Let's use our knowledge and perseverance to protect as many people and to save as many lives as possible. We know how to get these vaccines out, and we must lose no energy or no time now. Thank you.
Thank you very much, Dr. Etienne. Pasamos ahora a las preguntas que nos han enviado con antelación. Empezamos con una pregunta de
Now
Laura.
we begin with a question from Laura Barros to the director. Laura Barros is from news agency EFE.
Brazil and Paraguay have lifted the health emergency
Perú y Brasil han eliminado ya las medidas se deben mantener las medidas de emergencia o es el momento de levantar todas estas medidas como el uso de máscaras y otras medidas de salud pública y sociales, doctor Etienne.
So let me thank you for this
Quiero
interesting
agradecerle
question.
por su pregunta interesante.
Each country
Cada
makes its
país
own decisions.
toma sus propias decisiones.
Cut off the translation. So let me thank you for this interesting question. Each country makes its own decisions on how to handle the public health and social measures related to the pandemic. And PAHO offers guidance on the factors that they can consider when lifting measures. The World Health Organization's Emergency Committee last week declared that the COVID-19 pandemic still constitutes an extraordinary event that continues to adversely affect the health of populations around the world and poses an ongoing risk of international spread and interference with international traffic and requires a coordinated international response. So we are still in a public health emergency of international concern. And the experts advise that countries should be prepared to quickly scale up public health and social measures rapidly if the rates of hospitalizations and deaths start increasing again. And also, countries are advised to continue using these public health measures, including the wearing of masks, the staying home when sick, increased hand washing, and improving ventilation of indoor spaces, even in periods of low circulation of the virus. These simple measures minimize virus transmission between people and, importantly, reduces the chances of a new variant emerging. We want to urge people in every country in the Americas to please get fully vaccinated against COVID-19. For priority groups such as health workers, the elderly, immunocompromised persons, and pregnant women, this means also receiving booster doses. Also, we should all continue to minimize our risk of exposure to the virus by avoiding closed spaces and continuing to wear masks indoors where people congregate. These steps protect not only us, but our family, our friends, and our neighbors as well. I just want to reiterate, the COVID-19 pandemic is not yet over. Variants of concern continue to circulate, and we may see a resurgence of cases and deaths at any time. Therefore, we must keep a close eye on the numbers, and we must be prepared to respond quickly. Thank you, and over.
Thank you very much, Director. Pasamos a una pregunta relacionada del Lunelli.
Now we go to a question from Acento in Dominican Republic. El asks, given the low statistics of COVID-19 in the country after, we now wonder what criteria should a country fulfill for it to be declared free from the virus. Another question is, we know that for WHO declares a pandemic, several cases should be reported in different countries. So what is required to say that it's no longer a pandemic? And so how many countries should report zero infections so that this can happen and it will be no longer a pandemic? Dr. Ugarte, thank you for your question. These questions are relevant and they are related to the comments just made by Dr. Etienne, because in fact, the number of deaths and cases in the last few weeks have been reduced to the lowest levels perhaps we've seen from the beginning of the pandemic. But as Dr. Etienne also said, this is not the time to lower our guard. The emergency committee agreed by unanimity that COVID-19 continues to be an important health emergency of international concern. And this committee is studying necessary criteria to declare the end of the pandemic, including characteristics and impact of COVID-19, the number of countries and regions that are being affected, as well as the level of transmission and the response capacity of the countries. But we are far from getting to that point. We have a long way to go. We need to continue to treat people, to continue to vaccinate people. We have not reached as a region as yet, and as the world, the levels that we need to have so that the virus does not continue to cause cases and deaths. There are still millions of cases and tens of deaths per week. And so the only way in which we can end this acute phase of the pandemic is to keep surveillance, have good clinical management, continue vaccination, and social measures. Given the scenarios presented by Dr. Etienne, it is still better to have very close surveillance because it is likely that variants will continue to appear. And in the base case scenario, these variants will be less severe or cause less severe disease, and maybe it won't be necessary to give any more boosters or develop more vaccines. But maybe in the worst case scenario, we will have a highly virulent variant appearing. And given this new threat, protection against serious disease and death, uh, this could also lead to the vaccine being less effective. But right now, we don't have a clear answer to these questions. They are being analyzed by the health experts of the IHR, and they are working in close contact with the countries. Each country which adopt their measures and then decide to either keep them up or relax them, they need to take into consideration that it is a very dynamic process, which does not depend only from one single country or on one single country, but it depends on the tight collaboration and tight relationship between different countries that share highly relevant information. The appearance of a new variant needs to be reported immediately. And at the same time, those countries reporting it should not be sanctioned because they are reported. On the contrary, and this is the process that needs to happen also at community level. We still see that in areas of very low transmission in the countries, there are still cases. And if those cases are not detected, then we could go back to conditions as we are seeing in some countries in our region and in other regions of the world where transmission can increase again. Thank you. Thank you, Dr. Ugarte. We have a question from Mexico, from Blanca Valadez, from Grupo Milenio. Mexico, is Mexico ready to call an end to the pandemic as Brazil and Uruguay have done? And what characteristics do we require to say that the pandemic is ended? Well, I think I already replied to that question, but let me then elaborate. Using the word pandemic, this is a situation which has large repercussions and legal implications, even in some countries, and it is related first with the pandemic or the uh, international emergency as defined by the IHR. And the other thing is the situation in a given country. If a given country has low community transmission, high response capacity, high vaccination coverage, a very low number of deaths, and a number of cases that are being actively detected, but there are very few that are positive, then this is maybe a situation where in certain conditions, many countries may decide that it is the end of the emergency phase, because emergencies has both internal considerations within their countries that depending on their legislations, they may restrict some liberties and restrict some processes within the communities that have both social and economic impacts. So these are different aspects. The end of the pandemic is one thing. So this is not something that one country can say, "Oh, I'm done with the pandemic." No, they can end the emergency phase of a pandemic, and this was also expressed by Dr. Etienne. Thank you very much, Dr. Ugarte. From Mexico, we have more questions from Blanca Valadez from Grupo Milenio. And excuse me, we've already done those. Javier Hernandez Garcia, Andrea Meraz from Grupo Formula, and others. They say that President Andres Manuel Lopez Obrador mentioned that they requested vaccine doses against COVID as part of COVAX so that they can vaccinate minors. How many vaccines are still coming through COVAX, and do you have enough supplies to vaccinate children with Pfizer, which is the only one approved for children? Dr. Barbosa. Yes, I apologize. I'm losing my voice. 24,600,000 doses have been provided through COVAX, and they still have some outstanding, 13 million from AstraZeneca. And that will fulfill almost the totality of the agreement through COVAX. COVAX is offering for 2022 only vaccines for children from Pfizer for the supported countries. We have 10 countries in the region who receive the vaccines with support for self-financing countries. COVAX Secretariat is negotiating with those uh, with the parties, and we hope that the COVAX Secretariat will be processing Mexico's request in brief, and we will try to offer Mexico another alternative, which would be purchasing those vaccines through the revolving fund. And I think Mexico's intention is a very significant one of also vaccinating teenagers and children. Once you have already uh, vaccinated the elderly and all those who are at a higher risk, then of course it is important to vaccinate children and adolescents. It is possible to in the future we will have more vaccines authorized for children. Right now we only have Pfizer authorized for children over 5 and also we have the vaccine for children older than 12. But there are some that are being evaluated at this point in time. Let's wait and see. COVAX will contact Mexico relating to their request, and we will provide technical cooperation to the country so that they can review the possibilities that they can begin offering vaccines for adolescents and children. Thank you very much. Thank you, Dr. Barbosa. We have questions that are follow-ups about eliminating measures such as the use of masks. A question from Enrique Cardenas from La Prensa, Panama. What indicators would lead us to stop using masks in closed areas? And in Panama, when could we start thinking of not wearing masks according to what PAHO recommends? Also from Telesur and Angela Valdivia from Mexico have also asked about that. Dr. Ugarte, a question about masks.
It is very important because the measures, one of the public health measures in particular, the protection of individuals, includes the use of masks, wearing masks, and this has also proven to be highly effective to reduce transmission when worn properly at the right time. There are several criteria that were published and that were also provided as recommendations to the countries regarding the implementation of public health measures, including wearing masks. Wearing masks is not the only one. There are many others, such as physical distancing, disinfecting hands, and also avoiding the 3 C's, as we call them in English, and many more. But when we refer to wearing masks, the recommendation is that at all levels, in all situations, individuals should apply personal protection. And if an individual does not feel right, does not feel healthy, should also implement further precautions. This is highly important because when these measures are loosened, are more flexible, and they decide that there is a low level of transmission and that the mask should not be worn in closed spaces or in transportation, people who wear masks could be seen under a negative light. And this is the best that individuals can do if they have a condition that could get worse than if they get COVID-19, or maybe they were in contact with other individuals. And this is a measure that continues to be highly relevant, and it also adds to other measures. So the recommendation still applies in all of the conditions. In any situation, the wearing of the mask is still advisable depending on the level of transmission. The measures can be adopted voluntarily, but only if there is a close relationship with the early detection methods and response method. We have seen that in some countries there has been a reduction in the number of masks worn, and also there has been a reduction in case detection. This is contradictory. Then they need to go hand in hand. Thank you. Thank you very much, Dr. Ugarte. Now we have a question on vaccines in Mexico. Andrea Veraz from the Formula Group is asking, I would like to know what is the recommendation to use the Abdala vaccine in children? Is it advisable based on PAHO's analysis? And they're also saying that Mexico has initiated mass campaign for vaccinating people older than 18 for them to obtain the fourth vaccine. What is your opinion, Dr. Barbosa? Thank you very much for the question. In connection with the Abdala vaccine, PAHO has facilitated the dialogue among the producers and WHO team so that the vaccine can be assessed and so that we can have the authorization for emergency use by WHO. This is the beginning of the process. This coming week, we have the first formal meeting. This is a process that may take weeks or months, but each country has their own regulatory authority. Mexico has an excellent regulatory authority, COFEPRIS, that may analyze all of the vaccines and also authorize the use in their own countries. So PAHO in that case does not have a role to make a recommendation. It is the regulatory authority. In the case of Mexico, it is COFEPRIS that has all of the capacity to issue or to conduct an assessment and a recommendation. We think that the higher number of vaccines authorized for emergency use will facilitate the situation, and that's why we are coordinating the work with the producers. As to the fourth dose, we do not have any recommendation. Here from PAHO, we are not recommending the fourth dose. That is being reviewed based on the available evidence. We know that it changes with each vaccine because each vaccine has a different performance in terms of duration of protection, and that may also vary depending on the variants. So we still have a recommendation for the third dose in individuals who are immunocompromised and the elderly. Thank you very much, Dr. Barbosa. Now we have a final question from Mexico. Melina Ochoa from UNO TV in Mexico is asking, yesterday the Federal Health Secretariat in Mexico indicated that we have had a decline in cases, death, and hospitalization due to COVID-19 for 3 months. What is the outlook? How long will this interepidemic phase last, the one that Mexico is going through? And the question is, right now we are going through the second vaccination week. Do you think that we could expect a fifth wave after these days of holidays in Mexico? Thank you very much. This is Dr. Perez. Yes, indeed, in Mexico, we have observed a continuous reduction in the number of cases. However, we should also remember that that epidemiological week number 14 led the Secretary of Health to report an adjustment of cases reported on April 7th, but the cases are still for 2021. It is also important to analyze bed occupancy at the level of the hospitals, and we can say that in general wards of the hospital, occupation is at 6% in Mexico, and for beds with ventilators, it is about 2%. As clearly stated in the question and also as expressed, we are seeing a continuous decline in the number of active cases. And yesterday, as of yesterday, the number of active cases dropped to 3,868 cases. And if we compare this to the previous week, this is a decline of 19%. We have a third consecutive period in which the 32 federal entities of Mexico have a green light as part of the epidemiological risk lights that they use based on the guidance of the Secretariat. It would also be important to recall, to add to this response, that in week 32, that is to say August 2021, and up to week 3 of 2022, that is to say January, that correspond to the period between the third wave due to the Delta variant and the fourth wave due to Omicron. The day that Mexico had the highest number of active cases was on December 20th, with 14,724 cases, almost 15,000 cases. As of today, there are 3,868 cases, as I just mentioned. So we could say that the country is in an interepidemic period. However, I would like to underscore the words, the remarks by Dr. Etienne. The recommendation is not to relax the health measures in the country, because given the instability that we see during the pandemic, as mentioned by my colleagues throughout the world, the increase in the number of cases in North America, the possibility of the emergence of new variants of concern and sublineages, and relaxing preventive measures could all lead to a surge in the number of cases. Also, as our colleagues mentioned, to secure access to COVID-19 vaccines for the population that still does not have the first schedule or the booster schedule to promote vaccination in the population that is in vulnerable situation, and also to convince all that have not been vaccinated are key elements. I think that this addresses the question by journalist Ochoa. Thank you. Thank you, Dr. Perez. We have other questions in the chat on wearing masks. I am going to ask a question in English.
I know you've answered this question, but just to say a few words in English, I will take for our colleagues in the Caribbean, our journalists in the Caribbean, I will take a questions about masks from Stephen Cyrillin, PJD2 Radio in St. Martin. Stephen asks, given the fact that a US federal judge has struck down the wearing of masks, particularly on board airplanes, what does that mean for countries who for the past 2 years are trying desperately in their quest to contain the spread of COVID? Dr. Ugarte, please.
Thank you, Luciana. Thank you, Stephen. As you know, the public health and social measures are being applied and implemented across the globe to suppress the SARS-CoV-2 transmission and reduce mortality. So that include, as I said previously, personal protective measures, physical distancing, avoiding crowded settings, hand hygiene, respiratory etiquette, and mask wearing. So there are many, personal protective measures that are being implemented. One of them is mask wearing. So decision makers in each country should apply a risk-based approach. When considering the use of masks, for example, for the general public, regardless of vaccination or natural immunity status, in areas of known or suspected community or cluster transmission. So if there is community transmission or suspected community transmission, clearly the use of masks must be recommended by the national authorities, considering as I said, the risk approach. But WHO advises that the general public should wear a non-medical mask indoor or outdoor settings where physical distancing of at least 1 meter cannot be maintained. And that is part of the recommendation that was also sent to the countries, where in community or healthcare settings, for example, when measures such as mask wearing are recommended, they should continue to apply to everyone in healthcare settings and in community where the transmission is, for example, the SARS-CoV-2 incidence is more than 20 per 100,000 population. Those are type of criteria and risk approach, but each national authority must consider what are the measures that must be applied to protect their own populations. Regarding the travelers and the travel by plane, we know that the use of masks has reduced dramatically the transmission during traveling. So that type of recommendation must be taken into account when applying in one country or another country. Over. Thank you.
Thank you very much, Dr. Ugarte. We will continue in English. Take a question from Carrie Khan. She is the Mexico, Central America, and Caribbean correspondent of NPR. Carrie has 3 short questions. Why do you believe that vaccination rates are so low in Guatemala? Second, has COVAX been able to provide enough vaccinations to poor nations in need of vaccines? And finally, is PAHO working with local officials to increase the rate of vaccination in Guatemala and other countries with such low rates? Dr. Barbosa, please.
Okay, thank you for this question. Guatemala is improving in recent weeks the coverage. We have already now 47% of the population of Guatemala that have received at least one dose, and 35% had received two doses. This represents more than 60 million doses in total. Guatemala has implemented a phased approach to COVID-19 vaccines, prioritizing high-risk population since the vaccine rolled out in February 2021. It's important to highlight that for the first months, in many countries of the region, demand was high, but availability of vaccines was very limited. Since May last year, availability increased and coverage rose steadily, especially in urban areas in Guatemala. In the meantime, we have observed the increasing difference in uptake among urban versus rural population, with two-dose coverage ranging between 70% in Alta Verapaz, for instance, and 59% in Guatemala department. We have we are working with the Ministry of Health of Guatemala to address at least two important limitations that we have observed in the country. The first one was the cold chain capacity. Guatemala had a very limited cold chain capacity, so thanking the donors that provided the funds to PAHO, like the US, like Canada and others, we were able to support and to strengthen and increase the cold chain capacity in Guatemala. So this also allows the vaccines to be available in rural areas. The other topic is communication. In Guatemala and in other countries, we have many misinformation regarding vaccines on social media platforms. This is a really important issue. We are working with Guatemala, not only with the Ministry of Health, but also with local leaders, indigenous people leaders, translating communication material to the different languages that are spoken in Guatemala. So with this approach, we are working with the Ministry of Health in Guatemala. The vaccination is increasing, and we are strengthening the capacity in order to achieve the 70% coverage that is the goal that we have to achieve by June of this year. Thank you.
Gracias, Dr. Barbosa.
Thank you, Dr. Barbosa. We move on to a question now from Henry Cardenas and also from Gravian Collin and Farariachi from Noticiero Televisa in Mexico. The question is, WHO has reported on the emergence of cases of child hepatitis B, and this is the virus that is being investigated, that is being researched. Is it a risk for Latin America because some of its symptoms could be mistaken as COVID-19 symptoms? Dr. Perez, thank you very much for this question. This allows me to remind you that we can be affected not only by COVID-19. This cluster of viral diseases is a good example. In the case of children, this is the risk about getting the wrong diagnosis. We should recall that COVID-19 is a respiratory disease, and it has different symptoms from hepatitis, that is an inflammation of the liver. So the event that is the subject of this question by this journalist was reported initially on April 5th this year, 2022, in the United Kingdom, and they reported an increase in the number of acute hepatitis B of unknown origin in healthy children younger than 10 in Scotland. And on April 6th, on the following day, WHO started following up on this event, and by April 12th, the United Kingdom reported that in addition to the Scottish cases, there were other 61 cases being investigated in England, in Wales, Northern Ireland, and that most of them were in children between 2 and 5 years of age. By April 14th, Scotland reported that the 13 cases being investigated, there were two sets of those 13 cases were linked from the epidemiological point of view, which is important. These cases from the United Kingdom had clinical presentation as acute hepatitis B. Some had some bowel issues, bowel problems, including diarrhea, vomiting, and stomach pain. And it is important to indicate that most did not have fever. The initial hypotheses to relate this incident to some etiological agent were focused on infectious agents, or they could also be related to exposure to a toxic substance. There has been no link. There has been no link identified with the COVID-19 vaccine, and the detailed information that has been collected so far through surveys and questionnaires, for example, about uh, personal customs, traditions, and also use of food and drink have not indicated any specific exposure. There was also some suspicion that this could be some sort of toxic substance. Therefore, the toxic investigation is still underway, but it is more likely to think of an infection. And this is because in the lab research that have excluded the typical hepatitis B virus A, B, C, and D and E. But in 11 cases, adenovirus was found. In 13 of the cases, they identified 5 patients with adenovirus. The important aspect here among these cases and these alerts is that other regions are also conducting some epidemiological research. For the region of the Americas, the United States have reported a cluster of acute hepatitis cases of unknown origin. They identified 9 cases of hepatitis in children that had positive result to adenovirus and also negative to hepatitis A, B, and C. And those children were detected between October 2nd of 2021 and February 20th of 2022. All of the children went to the same healthcare center, and these were young kids between 1 and 6 years of age. And this is striking that this was that 77% of them were female, and all of these had symptoms that were compatible with hepatitis. With this, it is important to underscore the importance, as Dr. Etienne said, of continuing epidemiological surveillance to identify the early cases of any disease and be able to act. It is also very important to see what happened, the importance of the exchange of information fast to be able to act. All of this happens or has been strengthened thanks to the international health regulations that offer a health framework that is legally binding, as you know, and it has been agreed by 196 countries that are parties to the World Health Organization. This event is being assessed in terms of risk, but you can rest assured that PAHO, WHO, and also the authorities in the member countries will always follow this up, and any relevant information will be immediately shared with the health authorities of all of the countries for making the proper decisions. And finally, if you allow me, and also to better inform you, and as I said at the beginning, this is not only COVID-19 that has taken place over the last couple of years from the outset of the COVID-19 pandemic, and to date, the detection, verification, and risk assessment teams within PAHO and WHO, together with the member states, have acted in more than 135 different events that were not COVID related and that pose a risk to public health, and that have also happened in the countries and territories of the region. I hope I have addressed the question by this journalist from Guatemala. Thank you. Thank you, Dr. Perez. Now we move on to a question from Nicaragua. Gabriela Solorzano from Channel 12 is asking, first, would like to know whether PAHO has any information on the shipment of vaccines during the first half of the year, and whether you already have a date as to the estimated arrival time in Nicaragua, and whether this is a donation or a purchase through the COVAX facility. Dr. Barbosa. Thank you for that question. Nicaragua has already received vaccines through COVAX facility and also the vaccines acquired through the revolving fund, 1.2 million doses. The next shipment through COVAX that is scheduled for Nicaragua includes about 630,000 Pfizer vaccines that will be arriving in early June. Thank you. Thank you. I apologize, Dr. Barbosa. Thank you very much. The next question by Gabriela from Channel 12 is in connection with the number of deaths that Nicaragua reports one weekly starting in late 2020. How does Nicaragua compares to other countries? It is the country that has the lowest number of deaths. Dr. Perez, thank you very much for that question. Also, I think that this allows me to underscore what has already been mentioned today in connection with epidemiological surveillance. As of April 19th, that is to say yesterday in Nicaragua, we had 14,371 cases reported in 233 deaths. This observation of absolute figures as an indicator of health could help us understand that there is a lower risk as compared to other populations. However, it is highly advisable, and this is the way that we work, instead of absolute figures, to use rates of incidence. And when we observe the data on mortality rates in Nicaragua as compared to other countries, yes, it is possible to observe throughout time an incidence rate in number of cases and deaths very low as compared to other member states. But these comparisons, and once again, these comparisons need to be understood carefully. We need to remember that the cases and the deaths that are used in these estimates depend on the surveillance system that each country has, and they also depend on the sensitivity of that system to identify and report the cases and mortality. So for that reason, it is important to use the guidelines published by PAHO WHO to strengthen surveillance of COVID-19. There is a final updated guideline as of February 22nd. There is a new one that is about to be published, and there is an analysis and consideration for implementation of public health surveillance in connection with COVID-19. The guidelines have different approaches and also how they can approach mortality, how to use, for example, the civil registry and also vital records to have that information, and also the possibility to use ad hoc surveys to determine surveillance and the rapid identification of mortality. And as in the case of Nicaragua, where COVID-19 data is used, and also the number of deaths due to COVID-19 in various hospitals, which report at least weekly. And they also have, as part of that information, the mortality in various communities and also healthcare centers, etc. It is also important then to have a clear idea that surveillance data is key, in addition to using them to create a model for excess mortality, that is the mortality due to indirect effect of the health systems. I think that I have addressed the question by the journalist. Thank you, Dr. Perez. We have 2 or 3 questions that we are going to accept today. The next one, Matias Luis from Netscape in Spanish. He's asking, in the region, there are several projects for the development of new vaccines against COVID-19 in a moment at which the feeling is that the pandemic has been highly controlled or about to come to an end. Does it make any sense to continue to support these developments? Is there a specific need in the horizon? Dr. Barbosa.
Thank you for your very important question. During pandemic, we see that Latin America and the Caribbean are vulnerable because the production of vaccines as well as personal protection equipment, respirators, and other medical supplies is concentrated in some countries. So the countries of the region approved a very important resolution in September of last year during the Directing Council so that PAHO can provide technical assistance and lead an effort to reduce the vulnerability of Latin America and the Caribbean in this regard. So following from that mandate, we in PAHO launched a regional platform to manufacture vaccines and other medical products in the region. A first initiative is to develop the capacity of having a messenger RNA vaccines produced in our country. This So two were selected, two institutes, one Argentina, one in Brazil, and these proposals will benefit all countries in the Caribbean and Latin America because the vaccines manufactured there will be offered to the whole of the Americas through the revolving fund. Messenger RNA vaccines were chosen precisely, because these vaccines can be used for other diseases too, such as flu, dengue, and other diseases. So this is a new innovative platform that will be good for many years into the future. Many people believe that the messenger RNA vaccines will be the vaccines to be used in the future for all diseases. So we believe this is a very important effort that is being done to have a better approach so that all countries can respond to a new pandemic that may come to a region. Thank you. Thank you, Dr. Barbosa. Now we have a question from Manuel Lino González, Eje Central, Mexico. Many patients with COVID, especially those who have been hospitalized, have sequelae after this disease. Do we have an approach for this? We've already reached an hour, so please, Dr. Perez, a short answer. Yes, thank you very much for your question. As the journalist says, all the variants of this virus may cause a severe or critical disease and lead to post-COVID condition. This post-COVID condition refers collectively to a constellation of symptoms which are long-term, experienced by some people after they had COVID. Health services in the region have been organized and they include everyday new knowledge about this new condition and to manage these ways to manage these patients. They have all kinds of symptoms, even including mental symptoms. And so different treatments are being devised. WHO is developing guidelines for rehabilitation for all post-COVID conditions, and they will be published soon. From PAHO, we have a platform to gather information and be able to support the countries, in particular, the training of health services for treating patients. And I think basically this is the answer to the question. Thank you, Dr. Perez. We have time for a final question.
And we will end the session on that. Dr. Etienne, a final question for you. You mentioned that you have to use the vaccines you have. What are the countries doing with these vaccines, and what is PAHO doing to help them use these vaccines? Dr. Etienne, please.
Thank you for this question that helps me to speak a little about PAHO's work. PAHO is working closely with the countries on planning and implementation of national vaccine delivery strategies. So we've provided technical support to 23 countries for this planning, and we are providing financial support to implement vaccination campaigns in Latin America and the Caribbean countries. To make sure that vaccines are available in all parts of our country, we are working closely with ministries of health to identify their needs in cold chain equipment, to make the necessary purchases in accordance with PAHO's quality requirements, and to train their workforce in the use of these devices. So in this way, the cold chain is extended to the most remote areas, and vaccines can be offered at vaccination sites close to everyone's home. This will benefit COVID vaccination, but all of our other routine vaccination. To improve the vaccine absorption rates, we are working with health ministries, indigenous leaders, local authorities in several countries to adapt the successful vaccination strategies from the routine immunization program to the COVID-19 vaccination context, so we can quickly deploy and use these doses where they are most needed. Also, we are working with new and traditional partners to increase knowledge about COVID-19 vaccines and to promote cooperation. In Guatemala, for example, and I heard many questions about Guatemala, we are promoting vaccination in 81 communities, working with ancestral Maya, Xinca, and Carifuna authorities and local leaders and health workers. In Paraguay, we implemented a border vaccination strategy, administering both COVID-19 but also routine vaccines on both sides of the border with Brazil. In Ecuador, we provided financial support to local radio stations in the Amazon region so they can transmit COVID-19 vaccination information and mythbusters in local indigenous languages. We are also supporting risk communication with vulnerable populations in Colombia and Venezuela, promoting immunization messages among indigenous communities in Bolivia and in Amazonian communities. We are also working with religious leaders and community organizations on culturally sensitive vaccination campaigns in numerous countries. As I said, now we do have enough COVID-19 vaccines. But what is required is that we must work to extend the protection that they provide to all populations in the Americas. And I think that Vaccination Week offers us a unique opportunity to do this, but not only for COVID-19 vaccines, but also for routine immunizations. So as we enter into Vaccination Week in the Americas, we are hoping to see a massive increase in COVID-19 vaccinations, but also that we have taken the opportunity to expand the coverage for all other routine vaccinations. Let me thank you again for joining us, and it was good to be with you for another week.
Thank you very much, Director, for those great examples of the work of PAHO to help distribute the vaccines and make sure that it reaches all the populations in the region. A los colegas, muchísimas gracias por la participación. Llegamos ahora al final de la sesión de hoy.
Colleagues, we have come to the end of our session today. We will have our next briefing in 2 weeks, and please be on the alert to receive our messages. We have some questions that were left in the chat, and we will answer them. You will also find more information on our website, and you can send us follow-up questions to mediateam at PAHO at PAHO.org. So again, thank you very much for logging in, and we will see you in a couple of weeks. Thank you, and bye-bye.